thousands of researchers work in low and middle-income countries to improve health policies and practices. But does their research have an impact?
A staggering 86% of all applied research is not translated into policies, interventions, and practice.
We generate a lot of data routinely, and most people don't know how to turn this information or this data into usable information to advise policy.
Sort It, the structured operational research and training program, is changing those numbers. 1,000 people from 93 countries have been trained to address a wide range of diseases and outbreaks. Doctors, nurses, pharmacists, environmentalists, veterinarians and microbiologists are just some of those who have been through the program. Throughout 3 week-long modules, they learn how to design the study, collect and analyse the data and write a research paper. Then they spend another week learning how to communicate their findings for positive change.
We give our participants a range of tools. If that information is therefore more accessible to everybody and in brief, condensed formats that can be read relatively quickly, it makes it a much easier job for those who are making decisions or even policymakers to access the material, read the material, understand it, and then ideally act on it.
This integrated training approach resulted in 80% of Sort It trainees not only completing research, but reporting that their studies had a direct effect on health systems and policy in many areas.
Immediately my work was done. Without even having to go through the Ministry of Health, I presented it to my boss and he immediately effected the changes.
We've built in operational research into family planning. We built in operational research into cervical cancer screening that we just started about 2 years ago. So there has been a lot of improvement. In fact, some of the Sort It alumni are now training other program people using the Sort It approach, but with outside of the traditional TDR funding.
I feel very proud for this because we did this study and then we also had seen the impact, and then now we would like to give this message to other hospitals as well, because the operation research really is very important to bring a change in our community.
Previously, I feel that if there is some research, we have to do the very big things. But by Sort IT, I feel that small things can change the whole things of how the system can change, how the process of the any system can be changed.
Training me it's like you train an individual, but the impact is going to touch so many other lives and maybe the country as a whole.
We do a very cost-effective research in our own settings, in our own context, the problem identified by ourselves or by the local experts. And on the other hand, we gain the skills and we get the network also, a network of peers and then other experts. So you can continue to pass the knowledge and the skills. And also, so in that case, I would say the cost for this Sort It program is highly cost effective.